Hello, I'm Dr. Lenore Walker. I'm a professor at Nova Southeastern University in our Center for Psychological Studies. Together with my colleague, Dr. David Shapiro, who is also a professor at Nova Southeastern University's Center for Psychological Studies, we're going to talk to you now about preventing medical errors. Now, we all know what a medical error, or we think we know what a medical error is, when a medical professional will commit medical errors. But it's more difficult to think about what would a mental health professional have to do to look at a medical error being committed. The first and perhaps the most important point that I want to make is that a medical error only occurs when there's a failure to complete a planned action. It's not a personal failure, it's a system failure that we're going to talk about. It's sometimes the wrong plan was chosen for a particular aim that we have. It's not necessarily a bad outcome from the proper treatment that we choose. So we have to remember that we're not looking to blame somebody for medical errors. What we're looking to do is fix the system so that they don't occur again. So we're also need a couple of definitions as we kind of look at some of preventing the medical errors that behavioral health and psychologists and other mental health professionals might make. So let's start with some definitions. The first one I want to start with is called an adverse event. An adverse event is some kind of an injury that's caused by the treatment and not because of the underlying problems or the condition of the client or patient. So typical adverse events for mental health professionals include people who end up with brain damage or medication injuries that we don't pick up, suicide, violence towards themselves or towards other people, and more serious medical and psychological injuries. So these are what we call adverse events, and we're going to be looking at a number of possible advents when we work today in this webinar. The next definition I want to give you is a sentinel event. Now, a sentinel event is an unexpected outcome that invokes serious physical or psychological injury or even death. That's called a sentinel event. And of course, as you might imagine, these are rare for mental health professionals, but sometimes they do occur, especially if we're working in hospitals or we're working with people who have complicated medical problems in addition to the psychological problems that we're working on. The third definition I want to give you is called a root cause analysis. Now, the Joint Commission on the Accreditation of Healthcare Organizations, sometimes referred to as JCAHO, now requires the use of what they called root cause analysis whenever a sentinel event occurs. So if somebody should die, then we want to use a root cause analysis to help figure out what happened. To do a root cause analysis, it is necessary to study all the errors that we can identify retrospectively. We often call that a psychological autopsy. So when we do root cause analysis, it primarily identifies latent errors, another term you need to know, that occur as a failure of the system, the design of the system, prior to a sentinel event, and not usually active errors that may occur when people interface with the complex system. It's good to avoid individual blame, but rather to better understand how the system can work to prevent these kinds of errors together. So how would we do a root cause analysis? Well, there are a number of ways. Oftentimes, what we like to do is use a qualitative analysis. That is to study what has happened without necessarily looking at numbers or it's using statistics. Sometimes we might want to use them, but we're really looking to take apart an individual event, a sentinel event that happened, and we want to look at all the different kinds of things that happen leading up to this particular event. We want to use a multidisciplinary team when we can. So we may want to use more than just a mental health professional. We might want to engage the physician to find out what happened, or we may want to engage other people who have worked on the particular case. We also want all of the members involved in this team to be trained in doing root cause analysis. We're not going to train you how to do a root cause analysis today in this webinar. We're just telling you what it is and the fact that it really needs to be done. But what we want to do is to prevent these sentinel events and other kinds of medical errors from happening. And that's what we're really concentrating on today. After we do a root cause analysis, then we want to get everybody together and corroborate the final results. So we would like as many of the people on the team to agree that these are the results and these may be the things that need to be trained. How would we collect the root cause analysis data? Well, there are a number of different methods to do that as well. We could have structured interviews that might help us. We could review documents, charts, medical charts, for example, if somebody's in the hospital, or we could review our own notes. We can conduct interviews with people who have been involved, people who know not just the patient, but also the kinds of things that were done. Maybe a manufacturer of something that went wrong, maybe something that we didn't anticipate, a particular test that we thought we were getting results that were proper results, but the scoring system wasn't adequate or the interpretation wasn't adequate, would be something that would be more likely for one of us as a psychologist. Of course, if we're working in a team in a medical center, then it could be the wrong room that somebody was in, that they were placed together with somebody who they shouldn't be placed together with. So these are some of the kinds of things that we want to examine. We also want to develop a timeline or a sequence of the events both before and after the sentinel event occurred. And we'll do the best that we can. For example, we might be working for a third-party payer who's only giving us 6 sessions in order to treat somebody who has a serious mental disorder. That would be a root cause analysis that we did not have adequate allowance to treat the person in the way that we know we needed to treat somebody. So these are the kinds of things that we want to review and to check. Once we get those root cause analyses, we want to examine the sequence of the data. We want to determine what are the underlying factors. Are there factors we have in our control that we can make some changes? Or are these factors that we have to recommend to administrators who have the power to make those kinds of changes? Or maybe even to policymakers in Congress or in state legislatures to make changes. We have to determine what those factors are that need to be changed. We need to identify some active errors, some latent errors, and finally, identify factors that really didn't have any impact at all on them. Some of the typical root causes that we have found when we look at medical errors is that there may have been institutional negligence. That is, the institution that the client or patient was sent to was negligent. Perhaps it was an emergency room that didn't have psychiatric facilities, and the person was sent there and kept waiting, and we know of some cases that have been reported in the media where people are waiting and they end up either having serious seizure disorders, or they actually end up dying. Which is, of course, the sentinel event, because they didn't get care right away. There was no ability to triage properly. That's an institutional negligence. Maybe it's the management of the organization. Perhaps management of an HMO that isn't giving sufficient numbers of referral sources when you need a referrer. Maybe it's the work environment that we're working in. Perhaps we're working in an area that is not properly secured, doesn't have security, and we're working late at night, and adverse events occur late at night that we did not expect to happen. So these are all different kinds of things that could happen. Maybe the team didn't get along very well, that people didn't call you back or weren't talking to one another, or had different ways of treating the patient and didn't work those out. Important if they're to identify if that happens, so that we can make plans to have somebody help us when we need mediation in order to settle some of these problems. We may also then look at the patient characteristics, and many of the problems occur because of what happens with the patient. We take on a very fragile patient and the patient ends up dying. It may not be because of any of the institutional issues. It may simply be because the patient was terminally ill. And part of what we were doing was trying to keep them as comfortable as possible during that time. That would be sometimes that is a root cause analysis, and again, because we're not looking for blame, we're looking to change things. In a case like that, we may not want to change anything. There's always a question, this is a lot of work to do a root cause analysis. Is it useful? Does it pay off? Well, the closer to blame-free analysis, that is not blaming any individual people, but rather looking at system changes, the more likely we're going to have success from doing that. JACO reviewed 65 different suicides cases that they got where a root cause analysis was done. And 34 of them were in a psychiatric hospital, 27 in general hospitals, 14 on a psychiatric unit, 12 in a medical surgical unit, and 1 in the ER. The method of suicide was hanging themselves, 75% of them in the bathroom, bedroom or closet, and 20% jumping out of the window or off the roof. So guess what? JACO put out some regulations that really cut down on the patient's ability to have access, first of all, to the roof and to some of the ways that they were committing suicide in general hospitals where there were more suicides, but also in psychiatric hospitals.